Hey everyone, and welcome to RUBIN'S Mind Lab, where we break down the latest research into what it really means. Ever wonder how the COVID-19 pandemic really reshaped our health, not just for us, but for different generations? This study dives deep into that very question. Imagine a time when the whole world felt a bit shaken up by something invisible. That was the COVID-19 pandemic. It didn't just affect our physical health, but our minds and our daily habits too. But how did this affect younger folks versus older folks? And were the people who felt the pandemic's impact the most different from those who didn't? This research team in the Netherlands wanted to get a really good look at how health across different aspects, like our bodies, our minds, and our lifestyles, worked like a connected system during the pandemic. They weren't just looking at one problem, but how all these things were linked together. And they looked at this across 4 major age groups: kids, young adults, and elderly people. They even split people into 2 groups, those who felt the pandemic's impact a lot and those who didn't feel it as much. Think of it like trying to understand a complex web, and they wanted to see how the pandemic changed that web for different people at different stages of life. So how did they figure this all out? They used data from big surveys done in the Netherlands. For the younger kids, they talked to lots of secondary school students. For the young adults, they reached out through social media. And for the adults and older folks, they used a well-established system to get information. Basically, they collected a ton of information about people's ages, where they lived, their jobs, their financial situations, their physical health, their mental health, and their daily habits. To understand who was hit harder, they looked at things like how much the pandemic negatively impacted someone's life, if they had thoughts of harming themselves, if they experienced trauma, or if they had to delay important medical care. If someone reported a lot of these negative experiences, they were put in the high-impact group. If they didn't report many of these issues, they were in the low impact group. Now, for the really cool part, they use something called network analysis. Imagine each health factor, like feeling happy or exercising regularly or having a chronic illness, as a little dot. The lines connecting these dots show how strongly these things are related. A thicker line means a stronger connection. They built these networks for each age group and for each impact group. This allowed them to see which health factors were the most important, or central, in holding these networks together. After building all these networks, they compared them. They wanted to see what was common across everyone and what was unique to certain age groups or to those who were more or less affected by the pandemic. So, what did they find? First, when they looked at who was in the high-impact group versus the low-impact group, they found that no matter your age, if you were struggling financially, you were much more likely to feel the negative effects of the pandemic. Even though many differences were small, financial struggles stood out as a big sign of vulnerability for everyone. Now, about those networks, this was a consistent finding across all the age groups and both impact groups. Perceived general health was always one of the most important dots in the network. This is like your overall feeling about your own health. It was strongly linked to things like mental health and how much you were physically active. This makes sense, right? If you feel good overall, you're probably doing okay in other areas, and if you are doing well physically and mentally, you are likely to feel good about your health in general. But here is where it gets really interesting. While perceived general health was always important, other things became super central depending on who you were. For the younger folks, like kids and young adults, substance use was a really central factor in their networks. For the kids who were really impacted, their mental health status was also incredibly important. And for the adults and older individuals who were hit hard, the connections related to COVID infections, including long COVID, became very central. This shows that the pandemic's impact wasn't the same for everyone. It really brought different health issues to the forefront for different groups. What does all this mean for us? Well, the researchers suggest that because financial difficulties played such a big role in who felt more impacted, tackling economic inequality could be a key way to help people cope better during tough times, like future health crises. They also emphasize that since perceived general health is so central, any efforts to boost this feeling of well-being could have a ripple effect across many aspects of health. And the biggest takeaway, the one-size-fits-all approach doesn't work when thinking about health, especially during crises. What is crucial for a teenager is different from what is crucial for an elderly person. Understanding these unique connections within each group is vital for creating effective support and strategies for the future. Now, like any study, this one has its limitations. The information was self-reported, meaning people might have answered in ways they thought were best, not always their exact reality. Also, the surveys weren't exactly the same for every age group, so comparing comparing them perfectly is tricky. And because it was a snapshot in time, we can't say for sure what caused what. We can only see the connections. But despite these points, the study is super valuable because of its big picture approach and the sheer number of people surveyed. It gives us a much richer understanding of health as a connected system, rather than just looking at isolated problems. It really highlights how the pandemic stress wove itself into these health networks differently for different people throughout their lives. So, what are my thoughts on this? I think this study is a fantastic example of using powerful analytical tools like network analysis to really understand complex human experiences. The fact that financial difficulty was such a strong predictor for everyone's negative pandemic experience is a super important and frankly disheartening reminder of socioeconomic disparities. And the idea that perceived general health is the linchpin in so many of these health networks offers a really hopeful avenue for intervention. If we can bolster that general sense of well-being, it seems like we can have a positive impact across the board. The key here, as the researchers point out, is recognizing that different age groups need different kinds of support. What might help a teenager dealing with stress could be very different from what helps an older adult facing health challenges, amplified by the pandemic. Future research could dive deeper into those specific age group networks, perhaps using data that tracks people over time to understand how these connections change and what interventions might actually shift those connections for the better. That is all for this episode of RUBIN'S Mind Lab. What do you think about these findings? Let us know in the comments below. Don't forget to like this video and subscribe for more fascinating dives into psychology. See you next time.